I am excited to bring to you my next guest, Kashiti Long. Kashiti, welcome. Thank you so much for joining me today.
Thank you for having me.
Yes. And you know what? Let's just talk about how we met. I had a restaurant, as most people know, Exposed Vegan on West Boulevard. But I had to, unfortunately, close down when my mother passed away. And I was running the turkey trot. And I was so excited to see someone bring to me a flyer and let me know that her daughter had a practice here in Charlotte. And so, to my surprise, I'm like, oh, she's a Black woman. That is wonderful. I'm very excited. And then when I watched her walk away, I saw you and I looked at the flyer. I'm like, oh, I wonder if that's her. And so it was great to see, a physician in Charlotte that was running. So I was like, okay, I'm sold, because sometimes I see physicians and unfortunately, sometimes they don't work out as much as they say they would like to, but you just finished running. And so it was great to meet you. And I'm so glad that you accepted the invitation to come and to talk to our listeners today. So thank you again. And I'm so excited that you're here.
Thank you. I'm excited to be here. And I had actually gone to your restaurant a couple times before it closed.
Yeah. So thank you for being a customer. And again, I'm so glad that we're still connected. So let's talk to everybody right now about your services. So you have your own practice here in Charlotte. And you are a primary care physician, or can you share a little bit about what your practice entails?
So I am a primary care physician. I did my residency in internal medicine, which means I treat all the conditions that affect adults. So a lot of people think of, oh, so you're like a family doctor. Yes, but without the children and the pregnant people. So that's how I would describe internal medicine.
Okay.
So your primary care doctor will see you for most of the things that you have a concern about, or for your preventive care, or if if you're feeling sick or something like that, that's usually what your primary care doctor sees you for.
Thank you for explaining that, because sometimes I wonder, if I'm a little sick, or, my annual review, like what, can you explain, even to people like me, because I do go to different doctors. But what should you make sure that you go to your primary care physician for?
So everybody should see their primary care doctor at least once a year to get a physical, have their blood pressure checked, weight checked. Just depending on your age, you might be due for some cancer screenings or vaccines. It just depends on how old you are for some of that. But if you check in with your doctor once a year, they should be making sure that you stay up to date on all of your preventive care. And then if you have any chronic conditions, you probably are going to see them more than once a year, depending on what the condition is. You can also see your primary care doctor, like I said, whenever you get sick, or if you have a new problem pop up, like say you started having stomach pains, or you were having increasing shortness of breath or chest pains or something like that, you should probably see your primary care doctor as soon as you can.
That makes a lot of sense. Thank you for clarifying. So I will be making an appointment very soon, because I will be honest, I have not seen my primary care doctor in a little while. And I think it's because I was looking for a change. I was looking for a female doctor. I am going through premenopause. And I've had some physical issues with my knee and my shoulder. So I've seen my physical therapist several times, and I see my dentist because of my braces. Saw them yesterday. So I always feel like I'm at the doctor, but I don't think I'm at the primary care physician as much as I should be. So thank you for clarifying. I will admit to this audience. So for those who don't want to admit listening to it, I will admit for you that I need to see my primary care doctor more often than I should. And I have had cancer screening, so I will say that.
Okay, good.
So there's several things that I've done around that, but seeing primary care, I just haven't found one that I liked. So this is a good intro for us, and I will be making an appointment soon, and I will get back to everyone on what that was like. So can we talk a little bit about the name of your practice? Because I thought that was really interesting when I read it, Long Health and Wellness. So can you share a little bit about why that name?
So 2 reasons. One, I want you to live a long, healthy life and be well during that long life. There's no point in living long if you're not healthy and you're in the hospital all the time. So let's live a long, healthy life. The second part is that my last name is Long. And so it's kind of like a play on words, long, health, and wellness.
I love that. What's the why behind why you wanted to become a physician? Like, is this something that you always thought of when you were little? I know when I growing up, I changed from, the different things that I wanted to be when I grew up. Like, have you always wanted to be a doctor?
I have. So I started telling people I was going to be a doctor when I was 4. I saw something on TV and I asked my mom about it. And she's like, oh, they're doctors. They're saving that person, blah, 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 blah. And I was like, oh, okay, well, I'm going to be a doctor then. So I'm going to save people and help people. And that just persisted throughout my childhood. And then, math and science, you have to like those if you're going to go into medicine. And so I excelled in those subjects. So there was nothing deterring me. And then I did some shadowing and I did explore some other stuff because my mom's a dental hygienist. So she tried to talk me into being a dentist. But I was like, nope, I'm going to be a doctor. I'm going to do medicine and, save people's lives. So this has been a lifelong dream for me. And so opening Long Health and Wellness a couple of weeks ago is just like the culmination of all the work that I've put in for the last 30 some odd years.
Wow. I love it. So in reading your website, and we'll talk a little bit about how everyone can stay in touch with you, but I noticed that you offered nutrition counseling. And I am a triathlete. I love long distance races, even though it's the most challenging for me. But nutrition is very important. So can you share about, why you offer that service? Like, do you feel the same way I do? Like, it's so important, and what your services entail?
The nutrition counseling is a part of my lifestyle counseling because I feel like in this country, not enough attention is paid to lifestyle. And it's just like medicine, 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 as opposed to where can we, improve the root cause of the problem. There's a lot of messages about what is healthy, what isn't healthy. There's a lot of processed foods that are just pushed as being healthy, but they're still like ultra processed and have a lot of chemicals in them. And so I think 75-80% of your health is going to be what you eat and what you put into your body. And so you need to have a good foundation before you can, say that you're really healthy or like you've optimized your lifestyle to the point where you may or may not need medication. So my undergraduate degree was in nutritional science. And then after I finished my residency, I got certified in lifestyle medicine, and the bedrock of that is also nutrition. And so I just think it's one of the core foundations of being healthy.
Girl, you are speaking my language. I know when I had so many different ailments, one of the physical therapists that I first met with, he let me know, okay, you can get a shot for this. And I was just like, no, I've had 3 kids and that's just not something I'm looking to do, like shots anymore. There's so much I had to do to keep the babies. And it was like, okay, well, there's these pills that I could give you. And I'm like, I don't remember to take vitamins, so that's not going to work. And then he said, well, you could, keep your weight down and change your diet. I was like, why don't we start with that?
Exactly. Exactly.
The lifestyle change, like, why sticking me with stuff? Why is it the number one thing that you mentioned? So that's when I became vegan, and there's so much has changed. My weight automatically went down because I changed my diet and my lifestyle. So, I was happy about that. Like, you're always happy when, you're a little healthier, it's a little less weight on your body. But I feel better because I had a lifestyle change. And so, we'll have to talk about that after I make my appointment. But it's so refreshing to hear that come from a doctor. There's preventative ways of doing things, and you don't have to automatically say, roll up your sleeves, can I get a vein? Or just let me stick you here. That's not the first thing that you're thinking of. It's like, let's look at your lifestyle. And I wish we would have started with that with one of the doctors, but I was able to do my own research and make those changes myself. So it's really refreshing to hear that coming from you.
Yeah. So I think sometimes doctors assume, everybody knows that you're supposed to eat healthy and exercise. So then they don't talk to people about it. But different people's definitions of eat, I've learned over the years that people define eating healthy very differently. Like across the board, what one person thinks is eating healthy might be a salad that's only like lettuce, cheese, chicken, and ranch. And another person's salad is like spinach, tomatoes, cucumbers, chickpeas, onions, olives, and Greek vinaigrette. And so those are very different nutrition profiles when you break it down. And so talking to people about it is I think the gateway to like really understanding where people are coming from.
And you know that it's so funny that you mentioned that because I realized that, which is why I opened Exposed Vegan, because when the pandemic hit, there was such a fear coming from those that were much older than me, and they were coming to me for help and what they thought, they could do to keep their immune system up, to help their bodies to stay healthy so that they didn't get sick. They didn't know what that meant. They didn't know how to go about it. They didn't know how to start. And to your point, they didn't know what a healthy plate really looked like. And they were afraid. And so, I wasn't a doctor, of course. That wasn't something that I wanted to do growing up like yourself. But I knew that I like to cook for people. And I like to slice vegetables and I like to do those things. And so, that's why I have this and my YouTube channel. But that's where, a passion of mine is. But I realized in talking to people that they didn't know what that looked like. And they were afraid of, how to go about it and how to have the conversation about, is this healthy? So again, kudos to you to putting that in your practice and adding that to the conversation because it's needed. And there's a lot of people out there, young and old, depending where they are, they're afraid to have the conversation, but coming from a doctor, that I think that's really helpful.
I agree.
So I also see that you have lifestyle assessment and counseling. Can you tell me a little bit more about what that entails as far as your services?
In lifestyle medicine, there are 6 pillars, and whole foods plant-based diet is one, physical activity, avoidance of risky substances, social connections, sleep, and healthy relationships, I believe are the 6. And so asking the questions surrounding those are that's like a foundation of health, right? And so getting into where people can improve on the foundational pillars is part of like whole health as opposed to just like what medical problems do you have? Let's see what these other things are that could be causing some of your medical problems or could be leading you down the road to medical problems. So it's part of prevention, in my opinion.
And then also on your website, you mentioned that you share 5 dietary changes to improve your health. And there's a guide. How can people get more information about that? Can you share a little bit what that is and how they can get information about it?
So that guide is when you go to longhealthandwellness.com, you put in your email and you'll get that guide emailed to you. And it's just like a quick intro to these are some things that you could probably change today to start working towards being healthier. And it's just like a little brief couple of pages to give you some tips that you could work on if you're really interested in improving your health. And then continuing on from that would be to, join the practice and become a member and we can work on those things further. Or if you have a primary care doctor that you love, but they don't really talk to you about lifestyle, I have a lifestyle medicine consult that you can do. That's just the initial assessment of what you have going on, where you want to be, how you can get there. And we come up with a plan for you. And then you do a brief follow up, maybe a month or 2 later to see how that's worked for you.
I love that. I love that it's online and it's a guide. And like I mentioned earlier, sometimes there's a fear. People they want to do it. And I was at an event yesterday and people say, so many women came up to me and said, I really want to make a change. I get overwhelmed on how to get started. So this is a perfect example of how you can get started. There's a guide. There's someone you can reach out to schedule some time. So I encourage you to do so. Can I just ask if they're not in Charlotte, because my listeners are all over the world, can they still connect with you? Is that appropriate to do if they're not in Charlotte?
So if you are in North or South Carolina, I can see you virtually. If you want the primary care membership, I need you to come into the office for at least that initial visit and then maybe like once a year or once every other year to maintain primary care access. If you just want the lifestyle medicine consult, we could do that virtually if you are in North and South Carolina, because I'm only allowed to give advice to people in states where I'm licensed, and that would be North and South Carolina.
Makes sense. Thank you. So North Carolina and South Carolina folks, I've opened the door for you. I've given you a connection. There are no excuses. Here's someone right here who has wanted to do this since she was 4. And so please reach out to her. Let's just talk about how can they reach out to you for those that are in North Carolina and South Carolina.
So the first step that most people are going to go to would be the website. So that is longhealthandwellness.com. And you can see all the information about the different services we offer. There's a frequently asked questions page if you have any questions about anything. I can also be reached by email at longhealthwellness@gmail.com. And then the office phone number is 980-272-0061. That does ring directly to me. People are often surprised when I answer the phone when they call, but that's part of the practice. You get me when you call, and that's just how I'm running things right now.
Thank you. All right. We have the information. I'll include things in comments. So if you weren't able to type, write everything down really quickly, have no fear. They're listed in the comments below. So anything else that you'd like to share with our listeners?
Having a good relationship with your primary care doctor is part of the foundation to good health. So even if you don't come see me or join my program, finding a primary care doctor that you trust and can reach and can see when you have a concern is very important. And I encourage you to find somebody in your area if you are not in Charlotte.
Thank you. Thank you for coming. It was great to connect with you. And I look forward to seeing you soon as I fill out the form.
Thank you for having me, and I'll see you soon.
Thank you.
Are you looking for more healthy recipes? Check out my memoir, Running for My Life. It's packed with recipes that have fueled my journey and can inspire yours too. Grab a copy today at exposedvegan.com. And if you enjoyed this podcast, don't forget to hit the like button, comment, and subscribe for updates, tips, and much more. Thank you for watching, and I'll see you next time.